YouTube channel. This is Notions 1 and my name is Ben. This video is about my medications that I am on for various mental health issues / mental illnesses as they are properly known, and I classify them as mental illnesses as well. I suffer from paranoid schizophrenia, severe social anxiety and depression. I also get migraines and I have high blood pressure, so I am on medications for all of these things. In total I am on 6 different medications, half of which are addictive and hard to get off of. I'll start off with one of my favourite ones that calms me down and helps a lot of my anxiety. I take 6 of these a day and they're called diazepam. As you can see there, these are 5mg yellow tablets. I get 168 of these a month on prescription, and I'll show you there that 6 packets, and they're all pretty much full. There's 6 of them gone from one packet, but the rest are totally full. So there's 162 tablets altogether there. So if I wanted to, and I was stupid, I could sell them for quite a lot of money, but I don't, because I actually physically need these. Having been on benzodiazepines since 2004, I have a physical dependency on them. The physical dependency means that I cannot stop them. If I want to get off these, I would have to taper them, which is titrating them, i.e. taking less and less every day. What you do is follow the Ashton manual, which is 10% cut every 2 weeks, and carry on like that until you're off. But only do further cuts or the initial cut if you are stable in the first place, which I'm not. I do not want to get off diazepam at the moment because there are so many other things that I'm on that could do with attention. Although I am stable, I'm on addictive medications. I suffer from insomnia, which I didn't mention, and I'm on these Zopiclone 7.5 milligrams. What I'm on about 100. 7.5 milligrams, the highest dose tablets they make. I also have the 3.75 ones, so I actually did half or more than half come off this stuff. I got down to just one of these a day, one of these a night, and I used to take Zopiclone in a day for my anxiety, so I did well, but I had to go back on it because I had so much trouble sleeping. Yeah, so my migraine headaches used to be treated by this, which is dihydrocodone. You in the USA may very well not have heard of this. It is like codeine, but 1.5 to 2 times as strong, and it is a much better effect. It sounds like a weak medication, but I would actually call this moderate, and I am on, I'll show you now that I am on OxyCodone. I know they're only 5mg capsules, but if you take enough of them, they do have a good effect, as well as obviously dulling my migraine headaches. I don't abuse them. I take what I'm prescribed, which is 4 capsules a night, which is obviously 20mg. And because I suffer from schizophrenia, I used to be a lot worse, and I am more stable these days because my medication is more sorted out. I take this quetiapine 100mg, 100mg tablets I should say. I take 150mg in total because I have the 25mg ones as well, so I take 2 25s and 100. That drug causes me sleepiness. A side effect from Seroquel or quetiapine, it's called both of them things, is drowsiness, as well as controlling psychosis. It can also be used as a mood stabilizer / antipsychotic in conjunction with a antidepressant medication or mood stabilizer like lithium, although I don't recommend that. I haven't actually taken it, but from what I've heard, it's a lot of hassle for what it's worth, and you can have bad effects of it. I can't remember what I've mentioned, but in the day I take that at night, the quetiapine. In the day I take this, which is Amisulpride 50mg tablets. This is a medication that is for psychosis and depression. It's an antidepressant in low doses and an antipsychotic in doses over 200 or 150mg, depending on who you ask and where you look. As well as that, because I suffer from high blood pressure, I have to control this. This is controlled by Bisoprolol Fumarate 2.5mg tablets. I take one of these. If my blood pressure was high on these, I would take another one. My mum has a blood pressure machine, so I check my blood pressure quite regularly to check it's in line, and it was something like not 100%, but it was about 120 over 91, which isn't too bad. It's a bit high on the bottom number. I can't remember what they're called now, but the bottom number is a little bit high. It's not a problem. Anyway, the effects of my medication. The diazepam. This can cause euphoria, it can relax you, it can stop seizures, it can help you get to sleep, causes sedation. Although it's not a sleeping pill, these are the side effects from it. It's it's quite a lot of different things actually. Diazepam has a wide range of uses in the medical field. And the Zopiclone, obviously it's a sleeping pill, so it causes sedation, and you can just be in a different kind of world, kind of a blurred world, where you don't remember anything short term very much. It messes with your short term memory big style, although your long term memory will stay, and when you stop it, your short term memory should come back, although I don't know because I haven't stopped it before. You'd have to ask people. The dihydrocodone, which I don't take anymore, side effects include euphoria, contentment. Also the diazepam, you do feel content. You feel like everything's okay, nothing matters. Things do matter, but not as much, kind of thing. And it's a painkiller, an opioid painkiller, so it dulls pain. I'll say light to moderate pain. And the OxyCodone, this is mainly actually prescribed for cancer patients. I'm very lucky to have a doctor who is willing to prescribe me this. I'm guessing my doctor prescribes me it because I'm on other very addictive medication, and he thought, what the heck, he can't really get much worse, can he, because he's on all this other stuff. And go through the quetiapine. This, I've mentioned it I think, but it causes sedation in doses higher than 150mg. 150mg to me doesn't really do too much. I could take that amount in a day if I wanted, and in previous times I've been on 600mg of this separated into two pills, so two 300mg pills a day. Can't remember if they were prolonged or instant release. I think they must have been prolonged because they were 300mg. And the Amisulpride, this doesn't really have too many side effects. It has a bitter taste, a bit like less than the Zopiclone, but sort of like that kind of taste. And it doesn't really do that much, to be honest, compared to the other things. The Bisoprolol, which is a beta blocker, slows your heart rate down, so it can feel like you're a bit more relaxed, perhaps. Not compared to diazepam or Zopiclone or OxyCodone, but to a normal person, maybe a little bit more relaxed because it slows your heart down, can stop heart palpitations, things like that, and reduce the risk of a stroke, reduce the risk of a heart attack. It's safe to take a blood pressure pill. I'm only 29 years old, so I am on the blood pressure pill at a young age, but I did need it because I was drinking far too much. That's why I crossed over to diazepam, because I was on another one called lorazepam. In America it's called Ativan. I was on that, so I crossed over to diazepam. What else can I say? Withdrawal from these, with diazepam, withdrawal from that can be rebound anxiety, rebound insomnia, restlessness, even restless leg syndrome I've read once, although I've never had it. And it's more to do with opiates or opioids, restless leg syndrome in withdrawal. But you can get it off benzodiazepines apparently, and you can even have life-threatening grand mal seizures or petit mal seizures, usually grand mal of benzos, and this is treated as a medical emergency if you have a seizure. Just call an ambulance straight away is what I meant to say there. With Zopiclone, has sleepiness as a side effect and next day drowsiness. Diazepam also has next day drowsiness if you're not used to it, especially. OxyCodone, I would say euphoria, contentment, constipation as side effects to a lot of people. Withdrawal of OxyCodone can be diarrhea, depression, anxiety, pain, rebound pain obviously, things like that. And not too sure about withdrawal symptoms of a beta blocker, but probably a faster heart rate and higher blood pressure. So I think I've covered all my medications there. I've talked as much as I can think of on the spot at the moment about them. If you have any questions, please write below. If you have enjoyed this video and found it informative, please like it and subscribe to me if you wish to view any further videos on prescription medications or prescription addiction or any other thing, including radio control cars is what I'm into, and building computers, so I was an IT technician. Anything like that, if you're interested, please subscribe. I'd appreciate it. Thanks for watching and have a nice day.